Good morning or good afternoon, everyone, particularly all of our members of the Australasian College of Health Service Management. It's Neale Fong here, your National President. And in this time of COVID-19 pandemic, I just wanted to send you another message. Firstly, a quick update on the college and where things are at. We continue, as you know, to suspend all of our events and activities. However, we are introducing a series of national webinars. And our first one is actually next Wednesday. We have three Director Generals, Kath Stoddart from Northern Territory, Dr. David Russell-Weiss from Western Australia, and Chris McGowan from South Australia Health, all who are fellows of the college and who are going to be joining us on a national webinar to discuss about leadership in these trying times. So I invite you to be part of that. It's 6:30 p.m. Eastern Standard Time, and the equivalent times with daylight saving, of course, in the other states and territories and in New Zealand. So please be part of that. That's April the 8th. That's the Wednesday before Easter next week. Can I just also talk about fellowship? Those who are still trying to do the fellowship, we will be looking at extending our fellowship program and looking at the exam timetable. So don't stress about that, but be in touch with your fellowship coordinators. And of course, if there are any people that are in hardship with respect to fees, we did encourage you to continue to stay with the college. There will be value in being a member, but if you need to talk about that, please get in touch with our national office. First of all, I'd just like to say, as leaders in this time of the COVID pandemic, we are at the forefront. And firstly, can I just say how proud and how moving it's been to see the role that many of you as college members and non-members for that matter, and how you're stepping up in this time of need and crisis. I've been really pleased to see how, and I've been really proud to see how the public has reacted to healthcare workers. And I've been moved by the applause and the clapping that's been happening in various cities around the world as they recognise that the work that we all do is just so important. So well done to everybody, and I know everyone is just working overtime to work to get on top of this issue. Can I just say, in terms of all of us as leaders, it's really important that we do look after our staff, and first of all, the physical safety of our staff in this crisis is very important. So let's just focus on the physical, the spiritual, the emotional, and the social. First of all, the physical. Look, I'm sure that you're all going through all of the protocols about how to care and how to take precautions. So I'm not going to dwell on that. I've been really disappointed to see some members of the public react to some of our healthcare workers, and in Western Australia, for example, they've introduced legislation to have up to 10 years in jail for people that assault healthcare workers in this crisis with respect to the virus. So it's really interesting. But look, care for people and the physical safety of our staff as leaders is paramount. The second thing is, of course, the emotional well-being of our staff. And it's our job as leaders to make sure that people are looking after themselves, that they're self-caring. Without us being up and 100% able in all of the capacities, then we'll be providing less than best care. And obviously the spiritual aspects too. Remember that we do need to take time to actually look after the inner person in each of us. And there are a lot of fears out there in our community. There are a lot of fears amongst us as healthcare workers who are right at the front line. We've heard stories of tragedies of healthcare workers succumbing to the virus internationally. So let's make sure that we really do look after our inner self and make sure that there's a level of resilience and understanding and care there. And of course, then the social well-being of ourselves in this virtual world where we're not seeing so much of each other, and many of you might be working from home. That's really important too. So plan out how you can still stay socially connected, particularly for those who are not working in their normal workplace. Three other things I just wanted to leave with you. There's some interesting articles at our webinar next Wednesday. We'll explore this about leading in these times of crisis, and hearing how three senior leaders are marshalling their staff and troops and communities to deal with this. There's this idea of surviving and thriving, and we can be very good at surviving a crisis, of actually putting all of our efforts into ensuring that we're across all the facts, that we problem solve, and that we stick together and get through it. But at the same time, the survival mode needs to be connected to the next phase, which is how we thrive. And so our organisations will get through this, and they need to be able to thrive later on. So I encourage you to actually look how your organisation is not only surviving, but it's setting itself up to thrive into the future. The second thing is that well-known saying that there is opportunities that come out of crisis. We only have to look at the way we're now working virtually, the massive revolution about how medical and allied staff in the healthcare world are working with telehealth and telemedicine. It's a game changer. It's an opportunity for us to redo the way things that we haven't looked at for many, many years. And of course, the other game changer is the whole working from home and what that all means. So out of all this, there will be opportunities, and that's the connection to not only surviving, but thriving. The last thing I want to say is make sure that we communicate. That our job of leaders is to be the communicators of what's going on. That communication as leaders needs to be consistent. That is, the message needs to be the same, and if it changes, then people need to be made aware of that. It needs to be regular. Make sure that you do have a communications plan as leaders wherever you might work, that it's frequent, that you don't leave people in the dark. And if you don't know all the answers, sometimes a partial answer is better than no answer. And so I encourage you to make sure that your communications as leaders comes to the fore. That's one of the key aspects of us as leaders in healthcare, is to communicate and bring people along with us. So look, on behalf of the college, stay with us. We're going to be providing a lot more input to you, which you can grab either in live or register and then watch later. And they'll be short and sharp, and hopefully they'll assist you in your journey to lead through this crisis. Thanks for listening. All the best.